My name is Jay Schulkin. I'm the Director of Research at the American College of Obstetricians and Gynecologists. I've been the director for about 16 years, participating in a wonderful collaboration between the college and Maternal Child Health Research Program. It's a program that's devoted to assaying women's health over the life cycle. Obstetrician gynecologists are responsive from pediatrics to geriatrics in terms of women's health care. In particular, it's during pregnancy-related outcomes. The collaboration between MCH and ACOG, two abbreviations, has been very fruitful, I think, for both. The CARN network began about 20 years ago, and it was initiated by MCH along with ACOG with the focus to monitor what ACOG fellows, that is those obstetrician gynecologists that are responsive to women's health care, were doing. There was very little data along those lines. And it was a quick way and a detailed way to gather research and to link research to the expansion of studies that impact what physicians actually need to know and what to do. We've published about 130 papers in peer-reviewed journals, because we always aim for peer-reviewed journals. And so it goes from assaying or surveying what our fellows are doing to the development of guidelines in terms of how to meet their needs, to retesting where they are over time. The CARN works at its best when we find out what our fellows do, what we think they should be doing in terms of the evidence that's out there for certain kinds of practices, and what an intervention would look like in order to get them moving forward. It's in these interactions where I think it's been very, very fruitful, particularly in an expanding sense in which they're expected to know so much. One of the issues that came up several years ago was to look at oral health. We know that infectious diseases are linked to the vulnerability to low birth weight babies and preterm delivery. Oral infections were thought to contribute to that. The evidence is underwhelming for oral infectious diseases impacting directly preterm low birth weight babies, although it might be a contributing factor with other comorbid diseases. But we were able to initiate getting our fellows involved and asking questions about oral health to their patients. It was a fairly easy thing to do. The interactions between us, ACOG, and the Bureau were very fruitful. A meeting was convened, the leaders got together on both sides. We were able to get a study going that looked at what they were doing, and we're in the process of generating some guidelines. Well women care is a core issue for our fellows because most of it is about preventative care, preconception care, what you need to know before you get pregnant in terms of nutrition, in terms of vulnerability to diseases, in terms of good health. Part of our mission is to focus on the underserved. And in doing that, our focus has been on key issues that affects the underserved. They include preterm delivery. They include HIV. They include hepatitis C. They include obesity and diabetes and preeclampsia. These are core issues that affect a population of the underserved African American women to a disproportionate amount relative to others. That has been a core issue in many of the studies that we've done over many years. One of the ways this works well, that is the CARN network, is that we have many of the fellows work with us. I mentioned the younger ones that work with us and do studies with us, but it's not just them. I would say in the course of any year, we will have up to 20 or 30 fellows work with us on projects, suggest projects to us, and get involved with projects, so that there's a wide range that can go from the academic to the rural clinic, so that we look to include them, and in fact they are included in a lot of our studies. And that's a big part of the network and why the network has succeeded the way it has. Part of the job that I enjoy the most in these years is helping young fellows get into research. And I've watched this field change. When I took the job, it was 70% men and 30% women. In the short amount of time, it's the reverse now. Most of the fellows that work with me are young women trying to do some research. I love that part of the job, bringing them into the culture of science, so that there's a continuous function between practice and science. A part of the job that's most rewarding is demythologizing science so as to make it accessible to the fellows. and bringing them in so it's a part of their life over the long term. ACOG in general, and the Department of Research in particular, has a website where we list our activities and our publications, and I would invite those that are interested to take a look at it. I think you'll find it interesting. We look forward to doing this for a long time. It has been a very fruitful collaboration.